Living with OCD, obsessive-compulsive disorder, can feel like being trapped in a loop of intrusive thoughts and repetitive behaviors. But here's the truth. OCD is not a life sentence, and it doesn't define who you are. With the right understanding, support, and tools, it's possible to manage OCD and live a fulfilling life. Let's dive into what OCD really is, how it affects people, and what you can do to take control. What is OCD? OCD is a mental health condition characterized by two main components. Obsessions, intrusive, unwanted thoughts, images, or urges that cause significant anxiety or distress. Compulsions, repetitive behaviors or mental acts performed to reduce the anxiety caused by the obsessions. For example, someone with OCD might have an obsessive fear of germs, obsession, and wash their hands repeatedly to ease that fear, compulsion. However, OCD can manifest in countless ways, from checking locks to counting steps or seeking constant reassurance. Common misconceptions about OCD. OCD is often misunderstood. Let's clear up some common myths. Myth 1. OCD is just about being overly clean or organized. Fact. OCD is much more complex and can involve a wide range of obsessions and compulsions. Myth 2. People with OCD can just stop their behaviors if they try hard enough. Fact. OCD is not a choice. It's a mental health disorder that requires treatment and support. Myth 3. OCD is rare. Fact. OCD affects about 1 to 2% of the global population, making it more common than many people realize. How OCD affects daily life. Living with OCD can be exhausting and isolating. It can interfere with work, relationships, and overall quality of life. For example, time-consuming. Compulsions can take up hours of the day, leaving little time for other activities. Emotional toll. The constant cycle of obsessions and compulsions can lead to anxiety, depression, and feelings of shame. Social impact. Many people with OCD avoid social situations or hide their struggles due to fear of judgment. Tips for managing OCD. While OCD can feel overwhelming, there are effective strategies to manage it. Here are some practical tips. 1. Seek professional help therapy. Cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP, is the gold standard for treating OCD. It helps you face your fears and reduce compulsive behaviors. Medication. In some cases, medications like SSRIs, selective serotonin reuptake inhibitors, can help manage symptoms. 2. Practice self-compassion. Remind yourself that OCD is not your fault. Be kind to yourself and celebrate small victories. Example: if you resisted a compulsion, acknowledge that as a win. 3. Build a support system. Share your struggles with trusted friends or family members who can offer encouragement and understanding. Join an OCD support group, online or in person, to connect with others who get it. 4. Develop healthy coping mechanisms. Mindfulness. Practice mindfulness techniques to stay grounded in the present moment. Journaling. Write down your thoughts to better understand your triggers and patterns. Exercise. Physical activity can help reduce anxiety and improve mood. 5. Challenge your thoughts. Learn to recognize when a thought is an OCD obsession, not a reflection of reality. Ask yourself, is this thought helpful or true? Or, what evidence do I have for this fear? How to support someone with OCD. If someone you care about has OCD, here's how you can help. Educate yourself. Learn about OCD to better understand their experiences. Be patient. Avoid criticizing or rushing them to just stop their compulsions. Offer encouragement. Celebrate their progress, no matter how small. Encourage treatment. Gently suggest therapy or other professional help if they're not already seeking it. Final thoughts. OCD is a challenging condition, but it doesn't have to control your life. With the right tools, support, and mindset, it's possible to break free from the cycle of obsessions and compulsions. Remember, you're not alone, and there's hope for a brighter future. Have you encountered a person with OCD? What do you think? Let us know in the comments. And don't forget to like, share, and follow for more content on mental health and well-being. As usual, click subscribe and affiliate links to help this channel.